If you're an adult living with scoliosis, you've probably heard it before. There's nothing we can do. But that's not the full story. I'm Dr. Juan du Plessis, Clinical Director at ScoliCare, and in this video, I'll show you what we've seen work in practice, drawn from real experiences in the clinic. Because while scoliosis is often seen as a teenage issue, it absolutely affects adults, causing pain, poor posture, fatigue, even falls. The good news, non-surgical options exist. You just need to know which ones exactly make a difference. Here's the challenge most adults face when it comes to scoliosis. Most are told it's too late or often treatments meant for teens. A lot of the time, care is based on curve measurement alone. If the curve isn't considered severe, it's dismissed. If it is, the conversation quickly shifts to surgery. And what about everyone in between? Scoliosis in adults doesn't just sit quietly. It affects how you move, how you breathe, how you feel in your own body. It can cause muscle fatigue, pain, posture collapse over time, and even increase your risk of falling, especially as you age. And yet, so many adults are left without a clear plan. They're given generic exercises or passive therapies that feel nice in the moment, but don't lead to long-term change. Others are told to monitor it, as if waiting around will somehow improve their symptoms. What's missing is targeted, functional care that meets adults where they are. Not based on adolescent treatment models, not based on outdated ideas about aging, but based on how scoliosis actually affects the adult body and what we can do about it now. Let me tell you a story. A 56-year-old woman came to see us after years of living with pain and feeling like her body was folding in on itself. She had scoliosis and a noticeable shift in her posture. Her torso had begun leaning to one side and she felt off balance every time she walked. She tried the usual routes: massage, physio, a bit of Pilates, but none of it stuck. And none of it addressed the core issue. Her spine was changing and it was pulling everything with it. When we assessed her, we found a 51-degree lumbar curve and a visible lateral shift. That's a postural imbalance that, if left untreated, often leads to further pain and instability. And for her, it already had. She was struggling with daily discomfort and starting to worry about her long-term mobility. We designed a custom 3D Scoli brace for her, one that didn't just hold her spine but actively guided her into a better position. After 10 months treatment, her posture had improved. She felt more upright, more balanced, and more in control of her body again. But the most powerful shift wasn't what we saw on her x-rays. It was the way she moved, more confidently, with less effort, and without that constant fear that things would keep getting worse. That's what happens when care fits real life. Now, why did that approach work when everything else she tried hadn't? It's because we stopped focusing on her spine as just a curve on a screen and started looking at how it was impacting her life, her posture, and her ability to function day to day. And that shift in thinking is exactly what adults with scoliosis often need. So what exactly helps adult scoliosis cases? And just as importantly, what doesn't? Before we break it down, there's a quick resource I'd recommend. If you'd like to learn more, we've created a concise guide to help you understand adult scoliosis and your treatment options. Simply click on the link below in the description to read it. Now let's get back to it. When it comes to treating adults with scoliosis, we have to start by redefining success. For adolescents, we often focus on curve correction to prevent progression during growth. But for adults, the goal shifts because by the time you're 40, 50, or 60, your body has already adapted in 100 different ways. The real win isn't just straighter x-rays. It's moving with less pain, standing with more balance, and feeling stable enough to get through your day without fatigue or fear of falling. Pain, not curve size, is the key symptom to treat. Scoliosis throws off the body's alignment. creating asymmetries that affect how you move, how you stand, and the energy it takes to get through the day. It's like driving a car with a misaligned frame. No matter how strong the engine is, the wheels wear unevenly. It pulls to one side, and sooner or later, something breaks down. That's what happens when your body is out of balance. Over time, it leads to muscle fatigue, joint strain, and reduced mobility. And when pain or fear of movement sets in, the whole system starts to decondition. You're not just dealing with a curve, you're dealing with a whole body pattern that affects how you live. Balance and posture matter just as much as curve size in adults. Massage, heat packs, general stretches, these might feel good in the moment, but they don't create lasting change. They don't retrain the posture. They don't build stability. They're not bad, they're just not enough. Modern scoliosis care needs to be active, structured, and very specific. That's where things like 3D custom bracing, neuromuscular rehabilitation, and targeted postural training come in. Modern approaches focus on movement, strength, and bracing. They address the underlying mechanics of why you're feeling unbalanced or in pain. And when you match the right strategy to the right stage of someone's life, that's when the real change can happen. So, now that we've reframed what effective care actually looks like for adults with scoliosis, how do we put that into action? When you stop chasing perfect curves and focus on function, everything shifts. You stop relying on generic advice and start asking better questions. What's the right intervention for my body? What movements help me feel more stable, not more strained? And who's on my team to help guide this process? Let's take all of that insight and translate it into a plan you can actually use. First, focus on function, not just the curve. Ask yourself, ask your clinician, what's actually making daily life harder right now? Is it pain when walking? Trouble standing upright? Fatigue at the end of the day? That's your starting point. Because when we treat those issues directly, people don't just feel better, they regain control. Next, look at balance. If you feel unsteady when you walk, or like your body's leaning to one side, that's a sign the scoliosis is affecting more than just your spine. It's influencing how your whole body organizes itself. Specific postural exercises and neuromuscular retraining can help rebuild symmetry and control. And if there's been a history of falls or near falls, that needs to be addressed sooner rather than later. Then consider whether a modern brace could help. I'm not talking about the rigid, uncomfortable ones you might remember from years ago. Custom 3D braces like the ScoliBrace are designed to support adult spines without restricting movement. They can reduce pain, improve alignment, and often give people a surprising boost in confidence, because standing taller changes how you feel. Finally, build a team. Scoliosis care for adults isn't a one-person job. Work with clinicians who understand the condition, who can integrate chiropractic care, exercise therapy, and bracing in a way that's tailored to your goals. Because when care is collaborative and consistent, it's not just more effective, it's more sustainable. So let's step back for a moment. You've seen how scoliosis in adulthood isn't just about spinal curves. It's about how those curves impact your life, your movement, and your sense of stability. You've also seen that the right approach doesn't have to be extreme or invasive. It just has to be informed, specific, and built around your real-world needs. Adult scoliosis can feel overwhelming, of course, especially if you've been told that nothing can be done. But now you know that's not the case. With the right team, the right tools, and the right plan, you can reduce pain, restore balance, and move through life with more ease and confidence. That's not just possible, it's happening every day for people just like you. We'll leave it there for now. But there's a whole range of other videos waiting for you on the channel if you'd like to keep learning. I'm Dr. Juan du Plessis, and from all of us at ScoliCare, thanks for watching.